SpiceJet, India's second-largest airline, has spread its wings to the healthcare sector as well as SpiceHealth, a company founded by the promoters of the airline, led by SpiceJet promoter Ajay Singh's 24-year-old daughter Avni. They've signed an MOU with the ICMR to set up mobile laboratories that provide RT-PCR tests for COVID-19 at affordable rates. In fact, the Home Minister inaugurated SpiceHealth's first mobile laboratory in the capital earlier this week. SpiceHealth has said it will provide RT-PCR tests starting at 499 rupees. It says test reports will be available within 6 hours. The centre, remember, has capped the rate for an RT-PCR test in the capital at 2,400 rupees. Well, joining us now to talk about aviation demand, the outlook for the sector, as well as this new initiative of SpiceHealth, Ajay Singh, the chairman and managing director of SpiceJet. Also with us, Avni Singh, the CEO of SpiceHealth. Avni is also a trained pilot and will be navigating SpiceHealth. Avni and Mr. Singh, many thanks for joining me on the program here. Mr. Singh, let me start by asking you about the demand outlook. We have continued to see a pickup month on month. Of course, festive demand has aided passenger utilization rates across the board. But do you believe that this is likely to be sustainable? And do you think that the kind of restrictions, for instance, that the Maharashtra government has now announced, seeking RT-PCR certificates before you depart from these 4 states of Delhi, etc., will that impact traffic at all?
Well, Shereen, firstly, I think the demand pickup has been pretty significant. If you remember, we started flying again after the lockdown on the 25th of May. And on that first day, we had about 20,000 passengers that flew the entire network, India network, for all airlines put together. Now we are close to about 220,000 passengers flying. Of course, some of this is aided by the seasonal demand and festive season, etc. But we have seen a pickup, and we hope that it can sustain. We'll see what happens in the next few days. But then the holiday demand should pick up as well. I think what we are seeing is that there appears to be more leisure travel than business travel. Business travel is proving to be tougher in terms of, not as many people traveling for business these days. So the domestic pickup has been decent. Of course, internationally, the flights are still held up. And the only country which has really opened in any meaningful way for SpiceJet, at least, is Dubai, where we are now flying 7 flights a day, as opposed to the 12 that we were flying earlier. And now we're starting a new flight into Ras Al Khaimah tomorrow. But pretty much everything else, Bangkok, Hong Kong, other major international destinations still are shut for us.
Yes, you're right in pointing out that many of those international destinations continue to be shut. But what about destinations like London, Mr. Singh? Because you did get the clearance for being the designated carrier. What's the plan as far as those routes are concerned?
Look, after we got clearance for those routes, the UK has gone into a significant lockdown. And that lockdown is likely to be extended. So we might postpone that flight for a bit. But in the meanwhile, we fly wherever there are possibilities, and including, these flights that we are doing on a charter basis. During the COVID period, we flew a very large number of charter flights into North America, into Europe, into Africa, etc. And those did extremely well. But of course, regular scheduled flights will have to depend upon a certain normalcy on both sides.
Okay, so you're saying that there will be a delay in starting flights, for instance, to destinations like London. But since you brought up COVID and its impact, let me bring Avni into the conversation. Avni, you're a trained pilot. Why the decision to navigate into SpiceHealth?
Yes, Shereen. So I recently got my private pilot license earlier this year. And I might have plans to eventually get a commercial pilot license, but COVID hit and I moved back to India from the US. So as of now, I'm not doing as much flying as I had hoped that I would be doing. I was actually working in consulting in Delhi the past few months at McKinsey. And I think when COVID hit, it just became jarringly obvious that there was just so much opportunity and that there was just so much that one should be doing to make a difference in this time. So when this RT-PCR opportunity came up and that idea came on the table, I really couldn't help but get involved. And I think that's what kind of led me to take this initiative.
Okay, so lay out the roadmap for SpiceHealth for me, Avni. What is the plan? Where are these mobile kiosks going to be set up? What kind of numbers are you targeting? Which cities are you targeting?
Sure. So as of now, we have 5 labs ready. One lab was actually deployed today in Azadpur Mandi. The plan is to try to deploy as many mobile laboratories that we have built from scratch in the most congested parts of the country. We have currently tied up with ICMR, and through that, we are getting access to many state governments, and we are hoping to be able to spread this operation on a larger scale. We hope to add 10 vans or 10 labs by the end of this month. And then the plan is to eventually scale up to 100 labs. Each lab can perform 2,000 to 3,000 tests in one day. So that's the plan as of now. And where our whole focus right now is on scaling up and trying to put these labs in as many congested locations as we can.
Okay, so 10 labs by the end of this month. You said that you're also in dialogue with the state governments. Which are the states that you are speaking with, and how soon do you believe that you will be able to move out of the national capital?
So Shereen, the national capital is, of course, the central part of the country where cases are skyrocketing, and tests are just not available at a rampant enough pace. That's one of the reasons that we wanted to start with Delhi itself. We heard that in the northeast part of Delhi, for example, there's a lot of testing that needs to be done, especially in containment zones. So that's why our focus to begin has been Delhi. We are also in talks with other state governments like Haryana and states near Delhi, and then we eventually hope to expand to other parts of the country as well.
Okay, so the NCR region will be the focus area at this point in time. Mr. Singh, what is the plan? How do you foresee SpiceHealth aligned to SpiceJet's interests going forward? This, of course, is relevant today on account of the fact that we're continuing to be in the middle of the pandemic. But what is the future as you move ahead, post the pandemic?
Well, firstly, I think that it was important that Avni and her team play a role in the single largest problem that this country and the world is facing at this time. And the idea was, just as in SpiceJet, we tried to make travel affordable. The idea was to make COVID testing affordable so that many more people would have access to it. One of the ways to get rid of COVID, of course, is to increase testing and make sure that we can isolate those who are infected. So that's the plan. At $499, this is the cheapest and the most effective COVID RT-PCR test available in the country. And we hope to get it to as many people as possible. Once COVID is over, firstly, we would like to be involved in vaccination. So that's going to be a large program, and we can use the same mobile laboratories to help with the vaccination effort, which is going to be a massive effort of the central and state governments. After that, the same mobile laboratories could be used for any number of infectious diseases. And the ability of the laboratory to be in different parts of the country, wherever they are required and wherever there is of a particular disease, we think that there is a great opportunity in helping with that.
Okay, that's interesting. So you're saying that you could look at using these mobile laboratories for vaccine distribution as well, and that's a conversation that you're likely to have with the government, or perhaps already having with the government. But Avni, let's talk about the price. As Mr. Singh was pointing out, at $499, it is the cheapest RT-PCR test available in the market. How have you been able to bring the cost down? How does the economics of this work?
Right. So that was our goal from the onset to, as my dad said, make this a low-cost operation, just as SpiceJet is. So right from the onset, we have tried to create a low-cost laboratory on wheels without compromising on the quality of the equipment that we install within this laboratory. We've also tied up with a technical partner, GeneStore. GeneStore manufactures RT-PCR kits in India itself, in Faridabad. So I think that's one of the many ways in which we have tried to bring down costs by buying directly from that manufacturer. and then also, of course, bringing down our fixed costs. That said, going forward, we do hope to get involved in as much innovation and technology as possible to be able to bring down this cost even more.
Mr. Singh, what kind of investments are we talking about, into SpiceHealth, and what do you believe will be the investment plan going forward as you foresee the opportunities opening up in this space?
Well, it's tough to say at this moment, Shereen, but typically, I would think this is not a SpiceJet investment. These are personal investments from us. And I would think that initially this investment would be in the range of 50 to 100 crores to set up the first lot of laboratories and the work that we're doing in the initial.
Are you looking at building this out into a full-fledged diagnostics business going forward?
Well, we'll see how things turn out, but we do certainly feel that there is a need for better and lower cost diagnostics delivered wherever such diagnostics are required. So instead of the patients coming to fixed laboratories, which would be very far away, for laboratories to go to patients and do that in a cost-effective manner, we think is a significant opportunity in India and a significant service that we can do.
Avni, what has been the big challenge so far as you've got this idea moving into execution and on the ground? What's been the big challenge?
I think, Shereen, as you're probably aware, I'm not from a medical background, and my team, some of them are and some of them are not. So I think it's been a very exciting challenge to learn so much about the medical community and all the incredible work that's already being done to learn the technical bit of how an RT-PCR test works and how the actual operations of that would actually work. So really going in and looking at each and every element of that has been challenging and interesting, and I think that we're still learning. So only once we begin complete operations and start to scale up will I know what the real challenges are. But I think that is what I can answer at the onset.
Yeah. Yes, I would imagine that as you roll things up and out, you will come to terms with some of the challenges that this business may present itself. But Mr. Singh, I wanted to get your thoughts on some of the more recent developments and that clearance that's come in for the Boeing 737. What does that mean? Is there any more clarity that you've got from Boeing in terms of where things currently stand now with the FAA clearance coming in?
We have the same information as all of you that FAA has cleared the aircraft. Of course, the aircraft still has to be cleared by DGCA and by EASA and other regulators. So we'll see how that goes. But clearly, Boeing has caused tremendous losses to all its partners and carriers, and we hope that Boeing will compensate adequately all airlines, including SpiceJet.
Any more clarity on the compensation, though? The last time we spoke, I did ask you this question, but since then, has there been any forward movement on the compensation that could be forthcoming from Boeing?
Well, discussions continue, and of course, Boeing was, I'm sure, extremely busy trying to get their aircraft cleared. But discussions continue, and we hope that we can, find a solution to this soon, because the losses indeed have been extremely significant.
It's been a difficult period for a lot of the hospitality, travel and aviation businesses. Of course, things are starting to pick up now post the lockdown. When I was speaking with Indigo, they said that the burn rate has come down significantly since the time of the lockdown to now. What would the daily burn rate for you, for instance, be today?
It's tough to say, on a daily basis what it was, but it was really significant. As you saw that in the first quarter, we lost about 500 odd crores. That was pretty significant for us. It was close to, we were losing about 5-6 crores a day at that point of time. Of course, it's come down significantly. If you looked at the results of the second quarter, we lost about 110 crores in 90 days. So the burn rate was already down to about 1 crore a day. And we expect that that will be lower in this quarter as well. We will improve upon the previous quarter in this quarter. So I think many of the airlines, including SpiceJet, have used this opportunity to try and bring down cost in a pretty significant way in terms of the tough to control more sticky fixed costs like aircraft lease and salaries, etc. And that's helped. And of course, in SpiceJet's case, we've also worked very hard in building out our cargo business, which is now close to more than 3 times of what it was last year.
Mm-hmm. 3 times of what it was last year. That's the kind of growth that we've seen on the cargo business. But we're talking about one new initiative here, that is SpiceJet. Let me talk about another, and that's the seaplane business. What's the plan there? I mean, what are you factoring in as far as that idea is concerned?
Look, we just believe that we must innovate in this really difficult time. And, as far as seaplanes are concerned, we have just so many incredible holiday spots in this country where there are no airports. Road connectivity is really poor, but there are water bodies. And if we can use those water bodies effectively, we can open up a large part of the country to tourism, which is not open so far. So, if we get an enabling environment, we think that it's an interesting business to be in. And we've experimented with this first aircraft where we are running flights from the Statue of Unity to Sabarmati riverfront. And I think the response has been tremendous. So we believe that, great opportunity in India, but we need to think a little out of the box. Also remember that after COVID, there is a little bit of a shift in travel. I think there's much more leisure travel there now than business travel. So that mix has changed a little bit. And the seaplane business, I think, feeds into that. Today, if you look at it, in the large cities like Delhi and Mumbai, hotels have really, really poor occupancy. But if you look at holiday destinations like Goa, those hotels are full. So I would think that at least for a period of time with this work from home, etc., and offices remaining shut, business travel will be muted, but leisure travel will probably grow first.
Yeah. Yes, domestic leisure travel is likely to be the way forward, at least in the foreseeable future. Mr. Singh, what's the plan as far as bringing Avni onto SpiceJet is concerned? CEO of SpiceHealth today at 24, but what's the plan for SpiceJet?
Well, I think only Avni can answer that question. I think that she started with a project which is socially significant. And where there is great potential, I think she needs to build that out first. And for the foreseeable future, I think that's what she'll probably do. But she's probably better at answering that than I.
So Avni, since Mr. Singh believes that you can answer that question better, let me ask you, what's the plan as far as SpiceJet is concerned? Where do you see that fitting into the scheme of things?
I think he said it just right. I think that's definitely something that I would like to explore in the future, but this is a pretty big project that I've embarked on right from the onset. So I think I want to get the hang of this and really make it successful and make a real impact before I start venturing out into other arms of SpiceJet.
Is your dad your mentor and business guide as well?
Absolutely, yes. I think it's a pleasure to be able to work alongside and learn firsthand from someone as experienced.
I would imagine, what is the one piece of advice that he gave you before you started SpiceHealth?
I think he's always giving me advice. So it's hard to pin down the one piece of advice, but no, he's always told me to follow my gut and, to think methodologically, but also to follow my gut. And then, of course, he's always there in the next room for guidance. So I think that helps me.
So let me end by asking you, Mr. Singh, what's the do's and don'ts that you've listed out, if any?
Well, I think, my daughter's old enough and mature enough to figure her own path. But all I can say is that, look, you should, I think, remain optimistic in this world, and that every adversity, in every adversity, there's an opportunity, and we must try and find opportunity and find a new way. So I think it's extremely important that you also go deep into subjects and not just remain at a sort of a superficial level. You should really know your subject well, and I think that's what I would advise all youngsters, including us.
Well, very well said. Go deep before you go wide. That's the piece of advice coming in there from Ajay Singh, not just for Avni, but also for other budding entrepreneurs in the country. Avni and Mr. Singh, always a pleasure. Appreciate you joining us here on CNBC TV18 Conversations. Avni, we wish you the very best of luck with SpiceHealth.
Thank you. Thank you, Shereen.
With that, it is time for us. Thank you so much. With that, it is time for us to wrap up this special edition of the CNBC TV18 Conversations. Thanks for watching. Stay tuned. The news will continue.